Today's discussion is on cataract in children. We want to look at the causes, the treatment, and the intervention. And this will be taken by a senior colleague, one of my very senior colleagues, Dr. Halimi. She's a pediatric ophthalmologist, and she's our executive director in Restore Foundation for Child Sight.
Good evening, everyone. You're very welcome to today's event, the first public lecture undertaken by the Restore Foundation for Child Sight as part of the fulfillment of our education activities, in which we want people to become very well educated about common problems that affect children. I'm Dr. Halimi, and I'm happy to be with you today. The topic for today is cataracts in children, the causes, treatment, and prevention. I've often been asked, cataracts in children? People are used to, talking about cataracts in elderly people. Indeed, we more commonly see cataracts in the elderly, but its effects are more devastating in children, and it does occur in children. And so this is what we're here to educate ourselves about today. Right, so let's just get a hold of the statistics. A staggering 1.5 million children are blind from all sorts of problems worldwide. And every year, 500,000 more join this figure. Now, I'm not really talking exclusively about cataracts. I'm talking about the magnitude of childhood blindness all over the world. 500,000 every year, 1.5 million at the moment. And if you take this figure and divide it by a timeline, it holds every minute a child in the world goes blind. And so if we were all sat here, we had this webinar for 1 hour, it means that between now and the end of the webinar, 60 children would have gone blind, 60 more children all over the world. So blindness is a thing we really should be talking about, and so it is apt that we're here to talk about one of the causes of blindness. So in children. So cataract is one of the causes of reduced vision and blindness in children. We should then ask ourselves, what's a cataract? So a cataract is a clouding of the natural lens in the eye. And so we're all created with a lens in the eye, which is oval shaped and crystalline. It's clear. When it gets cloudy, then it's unable to focus. It can't let light rays into your eye. And that's what we refer to as a cataract. Now, this is an attempt to depict, so you can more clearly understand what a cataract is. So this diagram to your left is a section through the eye from front to back. So if you are standing at the side and you slice a person's eye from front to back, this is the side view you have. And so this structure in front represents the front of the eye, and this structure to your right represents the back of the eye, the back part you can't see. And so the lens in our eye is this ovally structure that is suspended near the front of the eye. And the diagram to the right is an attempt to use a 3D depiction to show you the difference between a clear lens, which should look nice and crystalline like glass, whereas when it gets cloudy, imagine when you have cotton woolly spots within it, that is what we refer to as a cataract. And so I hope that these diagrams have been able to sort of give you a better understanding of what we're talking about. Now, this is a picture of a cataract. So just to compare and contrast, the lovely girl on your left has normal, absolutely normal eyes. So we see an eye that doesn't have a cataract. The part that sort of strikes off as the black, the central back part, it looks nice and uniformly black, no shadows in between, within them. However, on the right, you can clearly see, unmistakable. Cataracts are not always this obvious, but in this child, they're crystal clear. You can see them. Those two white shadows that are interrupting the view of the middle of the eye, of the black part of the eye, these are cataracts. And as you can see, this is an infant. So it convinces everyone that cataracts are very much a disease that you can have in childhood. Now let's get down to specific cataract statistics. And so in Africa, 82,000 children are thought to be at the current time blind from cataracts. And every year, another 19,000 added to this figure. And so this sobering statistics calls for action. And part of what we need to do is all educate ourselves so we know about it and we know what to do. And if there's any sort of prevention, we know, that we need to jump on that as well. So let's go through the causes of childhood cataracts. And so I've enumerated here some of the causes. A lot of children are born with cataracts because their mothers have had an infection while they were pregnant with them. And so there are certain infections that can afflict a newborn's eye, starting right from the antenatal life of the child before being born. Rubella is one of the chief causes. Rubella is German measles. And so it's a sort of different, slight variant of the common measles we know. If this happens to women while they're pregnant, then there's a high likelihood, especially early on in pregnancy in the first trimester, there's a high likelihood that that child will be born with cataracts and some other problems. Other infections, chickenpox, toxoplasmosis, these are just for you to know that an infection in the antenatal period can give rise to cataracts in a newborn. There are genetic causes of cataracts. Sometimes they are inherited. So sometimes you can have cataracts being inherited, other members of the family, the mother, the father has cataracts. Sometimes you find it between siblings, So these are sort of genetic origin cataracts. And cataract can also go along with certain chromosomal abnormalities like Down syndrome. So when you have children who are born with what you call Down syndrome, oftentimes cataracts come as part and parcel of this syndrome. Prematurity is another reason why a child, a newborn, can have cataract. So if you have a child that's born premature, all the systems are immature. That's why it's called premature, because they weren't ready. And so that kind of child is prone to all sorts of things, prone to low oxygen in the blood, prone to poor circulation to the eye and the brain, also prone to infection, prone to low blood sugar. Any of these factors can give rise, can contribute. So sometimes a complex interplay of these factors can end up, that premature child can end up having a cataract. Now, injury. So trauma to an eye, be it a blunt injury or a penetrating injury with a sharp object, any of these can be severe enough to cause a cataract. Surgery as well. Sometimes you might have a surgery for one reason in the eye, and then it might not have involved a cataract, but it might then lead to a cataract. That's a possibility. It happens sometimes. If you have infestations, parasites, top on the list is what we call toxocariasis. This can be obtained by contamination when you have dogs as pets. So if you have dogs as pets, they can be infected with this organism, and their feces, if the dog's feces gets, it infects something a person eats, a young child can end up with toxocariasis, which can cause cataract and part of what it can do to an eye. Metabolic diseases like diabetes, especially everybody has heard about diabetes. And I don't know if you know, but if you don't, I should tell you that children can also have diabetes. Sometimes right from early childhood, it can be genetic or due to some viral infection. But when you have a child who's diabetic, the high blood sugar can seep into the eye, and the lens, this natural lens of the eye the sugar can seep into it, and it swells and leads to a cataract. And then you have galactosemia, which is another metabolic disease. If you have a child who genetically cannot handle galactose, you get that from lactose, and you get lactose from milk. So this child may start to react to even the breast milk that is being fed on as a newborn. And part of what can happen as a result of having the body not being able to break down the lactose is a high amount of galactose, which can cause cataract in the same way that the glucose can cause cataract in the diabetic child. Also, inflammation. Inflammation means that there's something's happened and the inside part of the eye is having a chemical reaction. Typically, an eye that is inflamed would be red. Inflammation can happen because of injury, or it can also happen because of other complex, immunological problems that a person might have. So if you have inflammation in an eye and it's not properly taken care of, then that child can end up with a complicated sort of cataract. And then having said, all of this, sometimes we absolutely find no cause for these cataracts. And when you look around, do all your tests and find no cause, we refer to this as idiopathic, which means you didn't find a cause. So sometimes, many a times, we have children who have cataracts are idiopathic. We never find a cause. Now, just to, it is said that a picture speaks more than 1,000 words. I just want you to appreciate what a cataract looks like. So this is an example of a hereditary sort of cataract. These are sisters, and they both have cataracts. Indeed, they have a younger brother who is a year old, and he already has cataract. So this obviously is a genetic hereditary kind of cataract. You can see it's not very white like the previous picture, but if you take a good look in the center of the black, you can see that white shadow in both eyes. The girl on the left, unfortunately, has a more severe developmental problem in her right eye. So this is not a cataract, this is actually a scar, but the other eye has a cataract in the center, and so does her big sister. This is another example of hereditary cataract. This time it's mother and son. That's the son to your left in theater. You can see her theater cap on, and this was the best opportunity to take photographs because he was such a young and quite uncooperative child. And so you can see those two white shadows also in the middle of the black. Those are cataracts. This is his mother. She's had a cataract. She knows she's had poor vision from childhood. She's never had it evaluated, didn't know the cause. When we saw the son and we noticed that one of her eyes was off balance, we took a look and we found cataracts in both eyes. So this obviously is a hereditary cataract. Cataracts can be from injury. We said that before. So that's called a traumatic cataract. And you can see it's typical in young males, at rough play and something hits the eye. In this case, it was a football. It was playing football when the ball hit his eye. You can clearly see that white cataract in there. Now, this presentation will be incomplete if I didn't give you a stern warning that not every white shadow that's seen coming, showing in the eye is a cataract. Beware of the commonest eye cancer in children. It's called retinoblastoma. And you see these two children here with the same whitish or maybe slightly yellowish shadows in the middle of their eyes. These are not cataracts. This is quite a different thing. This is a cancer called a retinoblastoma. It's already taken on considerable size to be obvious, and this needs to be seen to immediately. Otherwise, I will show you a picture now. I just need to warn you, the next picture coming is rather gory. And so if you don't have a stomach for it, you may want to take a look away for a moment. But when you leave a retinoblastoma unattended to like any other cancer, it will erupt onto the surface like that. So this child has previously had what you saw in the previous picture, but it wasn't treated. And so this is now the retinoblastoma. It has grown. It's a tumor. It has a cancerous tumor. It has broken out onto the face, and you can see the results. Indeed, this has spread. If you take a good look, if you compare the left side of his head with the right side of his head, you notice that unmistakable bump. That is part of the tumor spreading. You also notice that his cheek looks more prominent on the left than on the right. Again, those are the cancer, that's the cancer spreading. You notice his left ear is jutting out, sticking out, unlike the right, which is flat to the head. Again, there are tumor masses, and this is potentially life-threatening. The brain is the back neighbor of the eye. So once it's gotten to this stage, chances are it's spread to the brain already. And for a child like this, it may be too late. They might end up losing their lives. So I just want to give a caveat to say that not all white shadows in the eye are cataract. Some of them are cancer, and we need to have them always check it out quickly. Now, let's go back to cataracts. So what are the symptoms that you might have if a child has a cataract? So you have a young child with a cataract. And let me say that it's not only newborns. Cataracts, people can be born with it, or it can develop over years, even in the toddler stage. So, it can come at any age. But when you have an infant, a young infant with a cataract, the first thing that might be obvious, if the cataract is not white and really showing through to be appreciated, you would notice, especially if it involves both eyes, that this child has symptoms of decreased vision. So you expect a child who is about 6 to 8 weeks old to have what you call social smile. Expect such a child to focus on the mother's face and smile in recognition. So when this doesn't happen, when you have a child whose eyes are roving, just not focusing on you, it means there's a problem with that child's vision, most likely. Such a child also has, so that's what we call delayed milestones. And other milestones apart from the social smile are also delayed. And so you might have a child who isn't sitting as an age when they should sit, because you need vision to sit and balance. So if you cannot properly gauge your environment, you won't be able to sit. So you can have a child 6, 7, 8 months old who's not sitting. Perhaps you need to check those eyes apart from what you feel concerned about. Again, crawling, walking, you need to see where you're going. And so if you have defective vision, it's very difficult to see. Sometimes when the cataract is not so mature, the child can see, but because things are blurry, they're bumping into objects. And you should wonder why a child would bump into an object they should have seen, obviously. When some of them make it to school, those of them who don't have very dense cataract, but enough to impede their vision, when they get to school, they perform very poorly academically. That's because they can't see anything. They can't see the teacher's face. They can't see what you're saying. They can't see anything on the board. And so they're already squeezing their lead, struggling to see. That leads to poor academic performance. Oftentimes, you might see an eye that is wobbly. It's sort of undulating, moving side to side oscillations. You see the eye is vibrating sideways or up to down. If this is happening, it can be anything. It just means the message is the vision is poor. Something is causing that. One of the things that can cause that is a cataract. So we should always check. Squints. That means the eyes are not looking in the same direction. So one eye may be straight and the other is displaced, or it might be both eyes. And so squints happen when children have cataracts, especially when the cataract involves one eye. And so the better eye is looking forward, and the eye with the defective vision, the eye with the cataract, falls out of alignment. Because once an eye cannot see clearly, it loses its connection to the brain. The brain becomes disinterested, and it's the brain's job to keep those eyes in alignment. And so it might fall out of alignment, and the child has an eye that is pointing in a different direction. Of course, as we said, and as you've seen previously, you can spot the white spot yourself in the middle of the eye. So what should you do if you find any of these situations? You see a pediatric ophthalmologist who is a child eye specialist. Quickly, remember what we said. Not all white things in the eye are cataracts. Cataracts can deprive you of your vision. It may not cause death, but a cancer definitely would. So we need to take that important message away. You check quickly. Now, when you do go to the ophthalmologist, the child will be assessed, and the ophthalmologist can take, several decisions. The ophthalmologist may decide to observe. That's because, like I said, sometimes cataracts are not dense and mature size of cataracts that we can leave alone. We have dimensions that are not obscuring the vision as significantly as to need intervention. So we find this kind of situation, we keep that child under observation, knowing fully well that things can change, at any time in the future. And so such a child would be getting appointments to keep visiting the ophthalmologist, because we want to know when we stop observing and when we need to act. Also, we sometimes give spectacles, like the immature cataracts. When we find out that it's not of a dimension that needs surgery, sometimes we find out that the child has a significant refractive error. That's a focus problem. So we might find this child is long-sighted or short-sighted or astigmatic. These are focus problems. If we find that's the case, we need to optimize the eye's vision by giving spectacles. So sometimes you might have the need to give spectacles. Spectacles does not get rid of the cataract. You need to get that right. It doesn't clear out the cataract. It just means that the cataract can wait. That particular cataract is not quite of the size that needs intervention. However, when we do find that the cataract has become significant enough, then surgery is where what we need to do. And so the child can have cataract surgery, fast asleep, done under general anesthesia, and the cataract can be safely evacuated, and what we call an artificial implant, an artificial lens put in, because we've had to wash out the child's natural lens with a cataract because it's not functional. So we have to replace. Sometimes the child might be too young, and so this might necessitate a subsequent procedure after taking out the cataract. We might go in at another time, some years afterwards, to put in that implant. So again, let's look at some pictures. So these are before and after pictures. The picture on your left clearly shows that cataract. You can see it, beautifully on the right side. Then you can see this is after, the very next day after, you can see
this is what
this is a very see a bit of redness. This is within a week or two. Now, again, this is another cataract. So again, you can see that white unmistakable cataract, and then you can see the other eye absolutely clear. This is about a week or two after surgery. So typically the redness is receding. Now, this is a bilateral cataract, both eyes, in a 6-month-old. She came to us as a 6-month-old. And this is exactly how she was, with that permanent frown etched on her face. And, you know, she wasn't a very happy child. She was very irritable. She couldn't see anything. And after this, she had cataract surgery. Typically, we take her one eye at a time. This is the same child the very next day after doing the first eye, and she was fascinated with what she had discovered, vision. She was particularly fascinated with her socks. She examined and she didn't want to be interrupted at all. She just wanted, she was fascinated with that socks, and she kept looking at it and raising her foot and looking at it. The only thing that drew her attention was a shimmery toy, which you'll see in a moment. Yes. So that blinking rabbit, yes, did arrest her attention. So you can see she takes a pause from admiring her socks, and she's looking at the rabbit up, down, wherever we took it. This child has just done one eye, because one eye at a time, but you can appreciate the absolute change she can now see. So this is how transformative cataract surgery can be. Now, following surgery, there must be follow-up visits. And so the doctor will give follow-up visits. It starts frequently, a week, 2 weeks, and it continues to get longer the more the eye heals. And so regular post-operative visits, the child is likely to use eye drops, oral medications to heal the eye. And so these visits are important to be sure that there are no complications. And so a child also will need spectacles. Almost inevitably, the child will need to use spectacles to optimize the vision. Yes, you've taken out the cataract and the child can see better, but you want that vision to develop optimally. So you must give the brain the sharpest image you can have. And so the child would need to use spectacles. This may not be the case after a while, but for ab initio from the beginning, definitely. Now, it's important to follow up regularly, because you need to be on top of any potential complications early. You can't have things come up. Once you find them early, it's easy to deal with. And this is why further follow-ups are important. And I mentioned earlier the possibility of further surgery, because sometimes the children are too young to have that implant, the artificial lens I talked about. There's a certain dimension. You measure the child's eye. If it's not as big as you need it to be, you can take out the cataract and put in the lens, and then you and at that stage you go back and put in the lens. So these are the important thoughts about follow-up visits. Now, what are the consequences of delay with treatment? So if you have a child with a cataract and nothing is done in good time, especially if it's in one eye, this can lead to what, permanently lazy eyes. We call them lazy eyes because the relationship between that eye and the brain degenerates, and the brain is literally no longer interested in dealing with that eye, and so forgets about it. And so whenever you test such a child, you find out one eye sees beautifully well, the other eye is seriously lagging behind. We call these lazy eyes in medical terms, amblyopia, but lazy, commonly known as lazy eyes in common parlance. Now, again, on the long term, if you have a child who is bilaterally blind from cataracts and is unable to cope with vision and school, of course, the child has depressed life potential, poor or no education. Statistics have it that 90% of blind children never make it to school, 90%. And so we need to look for a way to quickly get children out of blindness so we can optimize the potential, their future potential, which is what this foundation is concerned about. So if a child has poor vision, poor education, they're going to end up dependent because their prospects for employment will be dim. They end up dependent, and there are long-term implications of such for society and the economy. So there's a huge amount of lost wages from inability to earn. And in addition, the child is dependent. It is estimated that it costs 6 times more for a family to raise a poorly sighted child compared to a normal sighted child. And so it's a significant drain. And it can also, we've already also mentioned the eye can squint. That's an extra problem. And then, of course, it's a cosmetic blemish because, people will keep pointing it out. What's that? What's that? What's that? What's that white thing in your eye? And so this can become a serious psychological dampener for a child. And then injury and death. When children are bilaterally hampered, vision-wise, they can't properly gauge their environment. And so the chances are high that this child can meet with an accident. They can get knocked off the road. They can fall into ditches. And so oftentimes, a lot of children who are blind also meet with early mortality. They die early because of these factors. Additionally, some of these diseases that cause the cataract can also give them life-threatening problems. For instance, rubella. Rubella, which I said is German measles, that can infect a pregnant woman and infect her unborn baby, and the baby can be born with cataracts. This baby can also be born with cardiac problems, heart problems, which might end up killing the child as well. And so we should talk about prevention. Sometimes it's just not possible to prevent. If you have a genetically determined cataract is inherited, there's nothing you can do. It's going to happen. And so in that sense, that particular one is not preventable. So early treatment is what would apply here. Proper antenatal care is important to reduce prematurity. When we talked about causes of cataracts, we said that premature babies are prone to many problems as a result of their prematurity that might end up contributing to cataract. So good antenatal care, good delivery services, and even optimal care where you do have prematurity can help to alleviate this particular problem. Now, immunization is very important. We have talked about rubella. We have kept mentioning German measles. German measles can affect pregnant women. Now, how can we stop this? It's by prior immunization. And so there's something called the MMR vaccine. The mumps, measles, rubella is a combination, which if you give to either babies or adolescent girls, young girls, before they start to reproduce, they can be immune to German measles, and so they do not have it while they're pregnant. The risk of contracting during pregnancy and passing cataracts and causing cataracts in a newborn would be much less. So immunization, very important. Injury prevention. We talked about injury and we've seen a few cases illustrated. So children at play, we need to be careful. Both sharp objects that are, we all wary of the typical sharp objects, pins, needles, scissors, but there are other sharp objects that are naturally in the children's environment. There are pens, there are pencils, there are rulers. So they need to be absolutely careful with these objects because this can put them in the eye and result in a cataract. When children are at play, they should be cautioned. No rough play, missiles, throwing things like bags, balls, stones, all these should be discouraged. It's very important. And then disciplinary measures. Oftentimes we come across children who have developed cataracts because someone wanted to mete out punishments and hit them either with a hand or a cane or something. Now, this can sometimes get them in the eye. And if that happens, very likely the child develops a traumatic cataract and many other potential complications in the eye from that injury. Sometimes children go blind. And so we need to find alternative measures, disciplinary measures that do not involve physical punishment because this can lead to cataract. We need to have proper care for red eyes. So oftentimes people have red eyes and then everyone feels, oh, it's a simple thing. There's no end to the list of things people put in their eyes: honey, sugar, salt, urine, feces, breast milk, kerosene, petrol, herbs, all sorts of things. And then even proper eye drops, but indiscriminately. You just walk into a pharmacy and then you're just giving a bottle of a drop. You need to be careful because not all red eyes. Let's start by saying some of those chemicals you're putting in the eye can give you other problems, not cataracts, but it can wreak havoc and give you a scar on the eye, which can significantly reduce your vision. That's on the one hand. But what I'm getting at is if you assume your red eye is just Apollo, as people would commonly say, and you do not have it properly taken care of, and it turns out it's an inflammation. I mentioned that inflammation in an eye, uveitis is called medically, will make your eye red, but the inflammation is not on the surface like your Apollo. It's actually coming from inside the eye. If you have this sort of situation and you're self-medicating, then got proper treatment, then there's a huge risk that such a child, and even if it's an adult, can develop cataracts, usually of complicated nature. Now, we should try to round off by summarizing. A lot has been said about cataracts. Let's just do a summary of what we've talked about. We've said that cataracts can happen in a child right from a newborn age, or it may develop during childhood, at some point in childhood. And when it's new, we call it a newborn, we call it congenital. When it's later, we call it developmental. It may involve one eye, or it may happen in both eyes. Sometimes one eye more prominently than the other. We need to know this. And the common causes of cataracts, of all the causes, rubella is quite common for newborn cataracts, infection and injury. I beg your pardon, rubella infection and injury to the eye. These are very common. Cataracts require prompt surgery to obtain good visual recovery. And so delay can mean that the eye never recovers optimal vision. And spectacle use is important for visual rehabilitation because even when you've taken out the cataract, there's still something left to correct of vision. And so this is where spectacles come in. We can prevent cataracts to a large extent if we have a universal policy that gives every young girl MMR immunization, because this makes a huge percentage of them immune to German measles. So even if they come across the virus whilst pregnant or any other time, they don't get the infection. Injury prevention, very important to prevent blindness, which commonly happens in one eye, in young boys especially, and adopt proper treatment for eye inflammation. So whenever you have an inflammation in your eye, don't take it for granted. Your eyes are red, see a doctor, get proper evaluation and proper treatment. Right, so you cannot overemphasize the importance of intervention. This is the same child who came with a permanent frown on his face, very irritable, 6 months old, couldn't sit. This is the same child 2 months later. She's done both eyes now, and as you can see, she's a beautiful baby, and you can't beat that toothy green. Right now, she's trying to walk. 2 months ago, she couldn't sit. Right now, she's definitely hoisting herself, and she's raring to go. So thank you very much for joining us. I hope that you have taken away one or two important things here, and we'll be glad to take any questions. And questions can be in the form of putting it in the dialogue box, or if you raise your hand, we can call upon you. Thank you. So if you'd like to ask a question, you can just unmute yourself and raise your hand, and we can call upon you. Or we can have it in the dialogue box.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
Alaikum assalam wa barakatuh. Sorry, are you trying to ask a question? I can't hear you. Please unmute yourself. Unmute yourself.
Assalamu alaikum.
Wa alaikum assalam.
I am Bilal Al-Kali. I'm speaking from Kaduna State.
Welcome.
Yes, my question is that I'm working with primary health care.
Yes.
Okay. Your foundation, my question is, your foundation, is there any intervention that is going to like introduce or that will reach primary health care? So that primary health care, they are the ones very close to the community, this community, remote area. There are some people that are having this cataract, but due to the fact that not to the places where they can get infected, so they might stay long isolation. My question is there any impact to what primary? I don't know. That's my question. I think so.
Thank you very much for the question. The volume was quite low. I struggled to hear you, but I think you were asking me if there's any role that this can play in the primary healthcare setting regarding cataracts. Yes, definitely. You know, we mentioned rubella immunization, the MMR immunization. So we know that the immunization takes place at that level of care. And we need education about the importance of immunization. We need advocacy. That's foundation to do the necessary quality research that allows us to advocate in the necessary departments, clinical department, where you can include MMR vaccination into EPI schedule. And so we know right now there's measles, there's no German measles, there's no. And so that's part of all this tends to try to invest. See if we can get to a point in the line where government will include the MMR vaccination into our EPI schedule, such that children, girls, by the age of 12, max, would have had this immunization. That's the one thing. The other thing is educating the community. And so, yes, we're based in Lagos right now. And so what we do is we make educative posters and we put pictures of all the sorts of things that are treatable. And so people need to know that if you see a child looking this way, we put an eye with a squint before and after treatment, and a child with a cataract before and after treatment. We put pictures of a cancer of the eye. And so if you see this sort of thing in your community, call us. And so that's important. But you have to understand that you have ophthalmology spread all over the country. And so you just need to know, have that awareness that if you see this problem, then the child needs to be sent to see the ophthalmologist. So that's very important. So immunization at that level, education at that level, to recognize the problem and to know where to send the child to. So we will, in due course, in due time, we will liaise with our colleagues so we can make educative posters that can be given out in this manner. And I'm aware that the Ophthalmological Society of Nigeria, especially the pediatric group within the society, the pediatric ophthalmologists, have some educative pamphlets that have been going around in communities really all over the country. I do not know how well distributed it is, though, in the communities. But these are the kind of things that we would be interested in doing. But it takes some discussion because these things, there's bureaucracy, there's some red tape. We can't just jump into a community and start to paste posters. So if we can go through the process that allows us to, have this information percolate to the community, sure, because a lot of education is required at the prevention level. Everything we've talked about. But when you do have a child, you need to be able to recognize, and that's by passing pictures. A picture, I can say 1,000 things to people in a community that the moment they see a picture, they know exactly all those children. They can immediately tell you XYZ child has this. And so they need to know that they're help. You can have help. A lot of people think that they're helpless. They have no knowledge that is treatable, or they have no access. And so, of course, finance is a problem as well. So these are all the things that we need to sort out. So yes, sir, there are things that definitely can be done at the primary level, and we will get to this. We are looking into this. We're already doing it in Lagos, but it's going to spread out. It's going to spread out. Thank you for the question. Right, now, can I just add?
Someone is asking if they can get the recorded version of this discussion.
Okay, yes, we can do that. If we have a way of collecting your email addresses, we can send them to you, attached to a mail and send to you. So you can just put if you're interested, just put your email address in the dialog box. Can I just add something that I've left out, and that's, very important as part of the answer to your question, sir. Regarding screening in the community, there's a concept of letting the teachers, how many times can the doctors be in the community to see what's going on? They're huge, their communities spread all around. And as we know, the number of doctors is already suboptimal to population. Therefore, the concept that you let teachers do the detection is very important. That's really the only way we're going to win. And so what the foundation has done, and you saw pictures of it in the intro if you were with us from the beginning, is that we go into the communities and we take teachers from schools. We've done 50 schools at a time, 3 teachers per school. Now we take these 150 teachers and we give them a talk about common eye problems in children. Then we show them pictures and we give them tools. We teach them, we give them vision charts and teach them how to check a child. And so you see, in the process of running this, they may come across some of these problems like the cataract. So in the process, they might find, they have this child in a class who absolutely can't see out of one eye, or the vision is really poor, and they may in the process notice there's a cataract in that eye. There are many, many other things you can detect like that. But I'm talking about cataract because this lecture is about cataracts. But I'm saying that when you have teachers screening children, it becomes easy to pick out the ones. They're with them many hours, 5, 6, 7 hours every day. So they are a veritable tool to utilize to pick out the children with the problems. That child you picked out that has a squint, because one eye is not straight, it may end up that there is a cataract in that eye causing it, or maybe something even more serious. And so screening at community level involving teachers and even other community members for children is absolutely important. But this is something the foundation does. Like I said, we've been doing it in Lagos. I believe a time will come when we'll be doing such things outside of Lagos as well. But right now, it's actually domiciled in Lagos. So far, we've trained maybe 400 teachers, and we expect each of them to go back to their schools and train other teachers as well. And so this is a way we want to empower every teacher to have the ability to pick out a child in trouble visually and send them to the doctor. Thank you for the question. A hand is raised, I believe. Is there a hand raised? Okay, I don't see a hand right now.
Okay, can I go on?
Yes, please, go ahead, sir.
Thank you very much for the beautiful presentation so far. It's quite educative. And with the second question that was asked as regards how you engage the community, particularly with enlightenment for teachers, I think I've seen such stuff done with asthma, with lawsuits here in Lagos, and it's quite educative, and it's good if you can reach out more to teachers so they can easily identify. My question is, a few days from now, I'm going to have World Glaucoma Day, sometime I think precisely March 12th or so. And this, talking about cataract has been very, very educative. I don't know what your foundation is doing so far to put the knowledge more in the face of the public so that people get enlightened about glaucoma, because it comes, as they say, the thief in the night to take the eyes. So I don't know, what are you guys doing to educate people more on glaucoma, since we have it in a few days from now? Thank you very much.
Yes, thank you. That's right. World Glaucoma Day, yes, from the 6th to the 10th. Thank you very much. Yes, you see, this is Restore Foundation for Child Sight, and so we're focused on children, especially the disadvantaged. Now, it is true that a child can be born with glaucoma, and I think in the course of this presentation I mentioned that you can have a child with glaucoma, and so our education about glaucoma would mainly be as it concerns the pediatric children. But randomly, on a day during the World Glaucoma Week, there are usually lots of lectures in the media, radio, TV, newspaper publications, and even eye screenings. We have all these going on, all talking about glaucoma. Most people are talking about glaucoma in adults. Now, we are a child foundation, child sight foundation, and therefore our focus will be on children. But we're definitely getting information. We have our website, www.restorefoundationg.org. If you go there, just type Restore Foundation for Child Sight, Google search it, you will find us. You will find that we have a blog. And in this blog, we have all sorts of topics. You find that these topics are mainly children's topics. And so, yes, we have glaucoma in children, and that's what we'll be talking about when that time comes. But I know that the media will be awash. TV programs, you tune in, talk shows. You'll find on every day within those 5 days, we'll find people talking. I can tell you that the Ophthalmological Society in Lagos is planning a town hall meeting also, where people can come and ask all these questions, so that we can give them answers, education. Thank you for your question. So if you still have a question, just unmute yourself and then go ahead and ask, please. Thank you. So I believe somebody, Nafisa, I believe you're taking down these email addresses, because we're going to need to send the slides to them at the recording. Okay, I don't see any other raised hands. This lecture, we wanted this lecture to last about an hour from start to finish, just so that we can give you the salient facts before, in good time while you're still awake, before you get bored, and also take the question and answer session within the same 1 hour limit. I think we started about 50 minutes ago. We still have another 9 minutes, so we're still open to questions if there are any questions. Thank you. Okay, do we have a question?
Thank you for the presentation. May Allah reward you abundantly for that. I have a question on someone that is placed on eye drop for the the cataract to be matured. How will the person know that is matured enough for surgery? Is it that the person will go to the clinic continuously, or how will he know? How will he or she knows? How will really know that, okay, this thing is mature enough for surgery or not? That's my question. Because I have a patient, I have somebody like that he told me that it's placed on an eye drop or medications for his cataract to be, to be matured enough for surgery. But I've not heard anything from him, and he has been placed on that for the past maybe 4 or 5 years or so. So I just wanted to ask that how will he or she know that, okay, this thing is matured enough for surgery or not? Thank you, ma'am.
Thank you for your question. Let me start by saying categorically that there are no eye drops for cataracts. There are no eye drops for cataracts. A cataract is an aging change. Your patient is not a pediatric patient. I assume you're talking about an adult. And the commonest cataracts are the ones that are associated with aging. And so just like our skin wrinkles and our hair grays, the lens in our eyes get cataracts. It's an aging change when you find it in elderly people. Now, there are no drugs that will clear the cataract. I assume that this person is probably on an eye drop for another reason. If this person has, for instance, glaucoma coexisting with cataracts, then you have to control the glaucoma with eye drops, and then while you're bidding your time for the cataract to get mature. So I just wanted you to get the point that there are no eye drops for cataracts. The eye drop is for another purpose, maybe allergy or a glaucoma. Now, if you have a cataract, it will blur your vision. The definition, the indication for surgery actually lies with the patient. So the way, because of the advancement of cataract surgery now, it's left to the patient to determine when he's ready. So when your vision is no longer adequate for your daily functions, then it's time to do your cataract surgery, whether or not it's mature. No longer do we wait for cataracts to get densely white and patient can't see you waving right in front of their faces. That's no longer the case. Of course, we still see cases like that for people who didn't know they could do it earlier. So what we're saying is, when you get to the point where your vision is reduced to the point where you cannot ambulate safely, there's a risk of you falling because you can't see where you're going properly. You're in the office, you're employed, you're still at that age when you're working, and your vision is impeded, and it's cataract causing it. But the cataract is not densely mature, it's still time for surgery. So it's highly individualized. This person will be getting should be, getting appointments to have serial vision checks. And every time you go to the doctor will ask you how you're getting on with your daily functions. And so it's your response that will prompt the doctor to say, I think at this point you should get it done, or perhaps you can still hold out. Sometimes the patient's personal choice to wait until they absolutely can't see anything, maybe because they're scared, they're afraid. But you can actually do your surgery even when it's relatively immature. It just depends on what it is impeding, provided it's the cataract causing it. Because sometimes cataracts coexist with something else. And so it might be the other thing causing more of the problem. And so this person's ophthalmologist needs to give him an evaluation. That decision is highly individualized. Sometimes a patient might delay because the other eye has good vision. So you might have cataracts in both eyes as an adult, but you do not have, your other eye is good enough to see. They're not equally dense, the cataracts. So sometimes people hold out. They delay doing the one that is ready because they feel they still have vision in the other eye. But let me quickly make a differentiation between adults and children here. Children have immature brains. They're not yet developed. So if they have a cataract, you have to do something about it when it's significant. Otherwise, they lose their potential, such that if you waste time and you attend to it much later than they needed it, their vision might improve, but it won't be remarkable. However, if an adult only develops a cataract as an adult, like the age-related ones, they had normal development up to that point in time. Even if you wait 5 years more to attend to the cataract, provided there's no other complication, they see well. Because it happened in an eye whose vision was already mature. For children, absolutely no delay. They must get an evaluation. You must treat as is required. Either observe or you go ahead and do surgery immediately when it's indicated. So that's the difference between adults and children. So this person needs to visit the ophthalmologist and let them discuss the person's daily functions and how they're getting on every day with the vision they have. That's what will determine when it's time for surgery. I hope I answered the question. I hope you understand. Thank you. So I believe we've had an interesting time today. We've spent about an hour and I don't have any more questions. So I thank you all for tuning in, for thinking this important enough to tune in. I hope that we've all taken away very important talking points from this. And I hope that the children around us we're all very sensitive now to notice if we think something is off about a child we're looking at, both as teachers and as parents and people in the society, generally. Thank you very much. We will have educative topics like this around children's eye health every 4 months, quarterly. And so hopefully, God willing, we will do this again about May. So please watch out for our notice and please join us again for another stimulating talk on children's eye health. And so thank you so much. I'll say bye-bye now to everyone. Thank you so much for coming on. Bye-bye.